Here we are back together again, friends, for another episode of the Juicebox Podcast.
My name is Jen. I'm a pediatrician and a mom to 3 kids. My oldest was diagnosed with type 1 diabetes about 1.5 years ago.
How would you like to share a type 1 diabetes getaway like no other? Join me on Juice Cruise 2026. You may be asking, what is Juice Cruise? It's a week-long cruise designed specifically for people and families living with type 1 diabetes. It's not just a vacation, it's a chance to relax, connect, and feel understood in a way that is hard to find elsewhere. We're going to sail out of Miami, and the cruise includes stops in Coco Cay, San Juan, St. Kitts, and Nevis, aboard the stunning Celebrity Beyond. This ship is chosen for its comfort, accessibility, and exceptional amenities. You're going to enjoy a welcoming environment surrounded by others who get life with type 1 diabetes. I'm going to host diabetes-focused conversations and meetups on the days at sea. There's thoughtfully designed spaces, incredible dining, and modern amenities all throughout the Celebrity Beyond. Your kids can be supervised, and there's teen programs, so everyone gets time to recharge. Not just the kids going on vacation, but maybe you get to kick back a little bit too. There's going to be zero judgment, real connections, and a whole lot of sun and fun on Juice Cruise 2026. Please come with me. You're going to have a terrific time. You can learn more or set up your deposit at juiceboxpodcast.com/juicecruise. Get a hold of Suzanne at Cruise Planners. She will take care of everything. Links in the show notes, links at juiceboxpodcast.com. If you're looking for community around type 1 diabetes, check out the Juicebox Podcast private Facebook group, Juicebox Podcast, Type 1 Diabetes. But everybody is welcome. Type 1, Type 2, gestational, loved ones, it doesn't matter to me. If you're impacted by diabetes and you're looking for support, comfort, or community, check out Juicebox Podcast, Type 1 Diabetes on Facebook. While you're listening, please remember that nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Always consult a physician before making any changes to your healthcare plan or becoming bold with insulin. This episode of the Juicebox Podcast is sponsored by the Omnipod 5. And at my link, omnipod.com/juicebox, you can get yourself a free, what'd I just say? A free Omnipod 5 starter kit. Free? Get out of here. Go click on that link, omnipod.com/juicebox. Check it out. Terms and conditions apply. Eligibility may vary. Full terms and conditions can be found at omnipod.com/juicebox. Links in the show notes, links at juiceboxpodcast.com. Today's episode is also sponsored by the Dexcom G7, the same CGM that my daughter wears. Check it out now at dexcom.com/juicebox.
My name is Jen. I'm a pediatrician and a mom to 3 kids. My oldest was diagnosed with type 1 diabetes about 1.5 years ago.
Okay, Jen, I like how long you took to pull yourself together before you said that. Because I don't think most people don't hear the part that happens before, because Rob edits it out, where I say, like,
Okay.
you know, the next sound you hear will be you introducing yourself, trying to give the idea to the person, like, go ahead and gather yourself and go ahead. And you did exactly that. Some people launch into it very quickly. Others wait for me to prompt them again. And we'll sit there for like an uncomfortably long time. And I'll go, you can go whenever you want. And they go, oh.
Right.
So I liked yours. Yours was like, let me think of how I'm going to say this. And I'm going to say it nicely. And we're on our way. So Jen, you have 3 children.
Yeah.
Do we want to say their ages or no?
No, that's fine.
Okay. 3 kids.
Mm-hmm.
Married?
I am.
And you're a pediatrician.
I am.
What do you take of this? My friend of mine is a pediatrician. It's been for a very, very long time. Went to a great school. I one day talked to him about being a doctor, and he said, I'm not a doctor, I'm a pediatrician.
Some days I feel more of a psychologist than a medical doctor. Yeah, it's fun. I've been practicing for about 15 years out of training.
It's a good long time.
Yeah. And I work part-time, so I can kind of do the mom thing most of the time.
Very nice. He described it once to me as like having to have a wide understanding of what's going on in the community as far as people's illnesses go, because in the end, he said, you know, most of the time you just see people coming in with what's going on. Does that fit the criteria to you?
A little bit.
Yeah.
Yeah. I mean, it's Also kind of like, your first patient weighs 5 pounds because they're a baby, and your next patient weighs 300 pounds because they're, an 18-year-old.
Oh,
So
yeah. I guess yeah. So there's a wide scope of people that you meet with.
Wide range. Yeah.
Yeah. Very, very interesting. Okay. What made you want to be a pediatrician?
Oh gosh. I don't know. I was one of those kids when I was, 8 years old, and they said, "What do you want to be when you grow up?" And I said, I wanted to be a pediatrician. I don't really know. I did a lot of volunteer work and a lot of work in high school and college, with kids. I always liked working with kids. And I originally thought about doing pediatric physical therapy was one of my thoughts, but really went with my gut and decided to go into medicine instead.
Wow. How long did you train for that? Give me, I left for college as a freshman, did a 4-year, and how long does that whole thing take?
So college, 4 years, medical school, 4 years, and then pediatric residency is 3 years.
Oh, wow. And you've been practicing for 14 on top of that?
Correct.
Oh, so you have 25 years of effort since you left high school for this.
Right.
Yeah. Have you been paid back?
Ish.
Tell people how many student loans you still have left.
Oh, I still have them. Yes. I'm definitely still paying off my loans.
No kidding. And the insurance is insane, right? The liability insurance and everything?
I guess so. My practice pays for that, thankfully. So.
Oh, lovely. Do you work in a kind of like family type practice, or has yours been swallowed up by a giant conglomerate?
Currently in private practice.
Do you have a preference? Have you done both?
I have not. Okay. I prefer to be in an outpatient setting. I was always one of those doctors who said I never wanted to work in a hospital. Mm-hmm. So I like being, just in a clinic and doing outpatient medicine.
Yeah. Tell me why you say a lot of your job is maybe being a therapist for people.
Well, a lot of people come in saying, "No, I'm worried about this," or "I'm worried about that." We do a lot of well child checks, especially in the first couple of years. You see the kids quite often. So a lot of it is, reassurance about your toddler doing this or your toddler doing that. And will I ever get sleep again? Or the teenagers, and teenage behavior. And, there's a lot of counseling involved with kids at all ages and family members at all ages as well.
Is that an on-the-job training situation, or is that something you feel like medical school and residency prepared you for?
No, I don't think any of the training really prepares you for that. I think it's just with a matter of time. I always joke because, my oldest child, I had him at the end of my residency, towards the end of my residency, and it just completely changes your perspective of things where I'm like, oh, I can't believe these parents are doing X, Y, and Z. And then you're a parent and you're going, oh, okay.
They think they're killing that kid 24 hours a day. They're looking they're looking for someone to tell them it's okay. He said this, He made a noise, he burped. Is he okay?
Right.
I can't go through this again.
Spot on their skin. Oh, yeah, it's a lot of that.
Well, so you think a little bit of the timing of when you had your first helped you maybe as you launched into your career?
Absolutely.
Yeah. Well, that's interesting. Okay. So let's fast forward a little bit. I'm just going to go out on a limb and say, I hope that you were able to diagnose your kid with diabetes. But tell me what happened and, how you figured it out.
Yeah. So I did, I get a lot of people saying, oh, at least you caught it early. At least you knew what to look for. At least his parents are doctors. And I think, I don't want to say guilt is the right word. It's just maybe a little, I don't know. I'm having the trouble finding the right word for it.
Are you trying to tell me that you still feel like you didn't figure it out fast enough?
No, I think I did.
You did? What's the adverse feeling from?
I guess just I wanted to be wrong.
Oh, you feel like you gave it to him because you recognized it, kind of thing.
Not that I gave it to him, but just I wanted to be wrong. I was like, well, maybe it's just that he's, just extra thirsty and growing and all of that. You want to be in denial. You don't want something to be right.
Jennifer, I'm going to try one more time to pick through the psychology of this. I might be way off. Do you not want to be part of the story you were just hoping that there was nothing wrong. That was big picture going to take up the rest of his life kind of feeling. Or do you hate that like part of that story is you going, oh, I think he has diabetes?
Maybe a little bit of both.
Yeah. Go ahead.
A lot of me just wanting to be wrong, I think.
Okay.
Where I kind of had it in the back of my mind, like, could this be? And then part of me getting him checked was thinking, okay, I'm going to be wrong.
Yeah, this is great. We'll do a thing. We'll have lunch and, we'll figure out what else did you think it could be if it wasn't diabetes?
Maybe just growing, being active. There's a lot of things that happen in the teenage years. So physiologically, so sometimes you just don't know if, what you're experiencing is right or wrong.
What symptoms was he having that got you thinking?
Mainly just the normal stuff, waking up at night to go to the bathroom and drinking a lot of water and, wanting me to refill his water and finding water bottles in his room at night. And that was about it. He felt fine.
It was the excessive thirst that clued into it right away.
Yeah. And I mean, his A1C was around 8 when he was diagnosed. So even the doctors said, they never see it that low at diagnosis.
Yeah. How long do you think it had been going on before you got him to the doctor?
Maybe a couple weeks.
Okay. That's pretty quick. Anybody else in your family have type 1, extended family?
Not blood related, but my sister's husband, my brother-in-law, has type 1 diabetes.
But nobody related to you or your husband?
No. We do have other autoimmune things in the family.
Like what?
Hashimoto's, ulcerative colitis. So with those two things, you're at higher risk for having other autoimmune things.
Can I ask a crazy question? Because I've been thinking about this lately. Anyone in your extended family, a great athlete, very flexible, can throw a ball hard, anything like that?
I wish. No.
No? I was getting a massage the other day. Somebody gave me a massage as a gift. My wife, by the way. 2 Christmases ago, I sat on this thing, stuck to my refrigerator for a year, made the appointment a day after the gift certificate expired, begged them into letting me use it anyway, and went to just, go get a massage. And the person who was doing the massage for me, she was lovely. And during the process, she was kind of going like off the side of my hips. My hip pointers hurt a lot. I was like, oh, that really hurt. And she goes right here. And she touched them. I said, yeah, the left one's worse than the right one. They've been hurting for a while. And she goes, okay, I'll fix that. There's part of you that's like, sure. But like she grabbed my leg, did a thing, was like leaning into my hip, like going. She goes, and I'm sitting there going, this hurts. And she's doing it. I'm like, this is not helping. And then as I'm thinking this is not helping, she goes, it's not releasing. And then she kept going. And I'm not kidding you. As the pain disappeared, she said, oh, I got it. And I was like, I said, that was really impressive. And I hadn't talked through the whole thing. By the way, I know myself. So at the beginning of the massage, she said, is there any instructions? And I said, yes. I am an entertainer at heart. If you start talking to me, I'm going to want you to have a good time. And I'm not going to relax. And I'm just going to talk through the whole thing. I was like, so please, just don't talk to me. And I was like, I'm not being rude, but trust me, I'll ruin it for you and for me. So she laughed. And she and I really didn't speak for a really long time. But I said, that was so impressive. You announced that you got it just as the pain went away.
Uh-huh.
How did you know? And she said, well, from working on myself, I've been able to figure stuff like that. I have Ehlers-Danlos.
Okay.
She starts going, it's an autoimmune. I went, yeah, I know. I was like, yeah, I got it. And anyway, so she had that. She and I chatted afterwards. And I said, maybe I should send my daughter in here. I said, no diagnosis or anything, but like Arden's really flexible. She has joint pain. Like, her shoulders feel like they're not in place sometimes. I was like, she goes, yeah, send her in. I'll help her. And I was like, awesome. And she said, how did you figure it out? And I told her, I kind of painted a bigger picture. I said, but there's this one thing I've always wondered. Both of my kids have exceptional arms. They both played baseball or softball, and they could throw a ball like a rocket. And when you watch them on video, what you see is they have this exceptional extension when they reach back, like so much more so than most people do. And I always wondered if that's part of that or not. Anyway.
I'm not sure.
Nah, you would have no idea. But I would just like, sometimes I say to people like, are there bipolar people in your extended family? And a lot of people go, yes. So I thought maybe I could like find a new question. Like, does anyone in your family throw really well? Anyway, it's a long way to go for nothing at all. But anyway, I think I might have her on the podcast, how to help that, because she was so effective with it and was telling me her own story that I think people would find interesting. But I digress.
Yeah. Cool.
Okay. So in the extended family, a little bit of that, but not a lot. Did it ever occur to you as a doctor? Did you ever say, I might have a baby one day that has one of these issues? Or is that not a thing ever popped in your head?
Not really. I mean, you always want your kids to be healthy, but never really thought about it.
Okay. All right. So we got him in the hospital. He's got his A1C around 8. They think you got it pretty quickly. Now, does the thing happen to you immediately where they think, well, you're a doctor, we don't need to tell her anything, she already knows? You can manage diabetes confidently with the powerfully simple Dexcom G7. Dexcom.com/juicebox. The Dexcom G7 is the CGM that my daughter is wearing. The G7 is a simple CGM system that delivers real-time glucose numbers to your smartphone or smartwatch. The G7 is made for all types of diabetes, type 1 and type 2, but also people experiencing gestational diabetes. The Dexcom G7 can help you spend more time in range, which is proven to lower A1C. The more time you spend in range, the better and healthier you feel. And with the Dexcom Clarity app, you can track your glucose trends, and the app will also provide you with a projected A1C in as little as 2 weeks. If you're looking for clarity around your diabetes, you're looking for Dexcom. Dexcom.com/juicebox. When you use my link, you're supporting the podcast. Dexcom.com/juicebox. Head over there now. Today's episode is brought to you by Omnipod. Did you know that the majority of Omnipod 5 users pay less than $30 per month at the pharmacy? That's less than $1 a day for tube-free automated insulin delivery. And a third of Omnipod 5 users pay $0 per month. You heard that right, 0. That's less than your daily coffee for all of the benefits of tubeless, waterproof, automated insulin delivery. My daughter has been wearing an Omnipod every day since she was 4 years old, and she's about to be 21. My family relies on Omnipod, and I think you'll love it. And you can try it for free right now by requesting your free starter kit today at my link, omnipod.com/juicebox. Omnipod has been an advertiser for a decade, but even if they weren't, I would tell you proudly, my daughter wears an Omnipod. Omnipod.com/juicebox. Terms and conditions apply. Eligibility may vary. Why don't you get yourself that free starter kit? Full terms and conditions can be found at omnipod.com/juicebox.
I tried to kind of keep that on the DL that I'm a doctor because I want people to talk to me like I don't know anything, because truthfully, I don't. As a general pediatrician, you see the kids who are sick and they come in, oh, okay, how's your blood sugars, this and that. Like, I really knew nothing about pumps and CGMs and this and that. I was a diabetes camp counselor back in the day down in Florida. But that was when kids were still doing, finger sticks before meals and lining up for their insulin.
Yeah.
So things have changed so much since I've been trained. So I wanted people to talk to me like I was just everybody else.
Yeah. Do you have kids in your practice who have type 1?
I do.
Yeah. Do you get very involved prior to your child's diagnosis? Did you get very involved in it, or was it one of those things where you're like, well, that's the endo and this is me?
Yeah, pretty much.
Yeah.
We don't have anybody locally for pediatric endocrinology, so people have to travel. So I pretty much make sure they're seeing their specialists, their A1Cs are good, they're doing what they need to do. Prior to this, kind of just let the endocrinologists deal with it all.
In that situation, are there overlaps that should impact your care that previously you weren't thinking about that now you are?
Absolutely.
Yeah. So another learning experience for you, like this is good. You think this will help a lot of your patients too?
Absolutely. So many things that I've learned about, especially with the pumps and the CGMs and the symptoms of things. I've learned a lot about 504 plans and school accommodations. So not just for diabetes, but for other chronic medical conditions. I really encourage families to be proactive and get 504 plans and make sure they're advocating for their kids' school system, which I don't think I did as much of before all this.
Are you telling me that there were other kids under your care that you maybe in hindsight should have said, hey, maybe you guys should have a 504 plan?
Or, yeah. I mean, I know the endocrinologists and the specialists tend to take care of that, but in reality, it's the pediatrician's job to say, do you have everything set up for what you need?
I've tried my hardest to forget about 504 plans because it harkens back to a terrible time in my life. But when you kind of laughed about it. So tell me a little bit about the process. So you realized he's going to need this. You started looking into it. It's not cut and dry as far as
it's not
what should go in the plan. You don't recognize at first that the school very well may not be thrilled that you're trying to apply a 504 plan, that they might fight with you or try to simplify it to limit their exposure. There's a lot of things that happen once this whole thing starts moving in that direction. But would you tell me a little bit about what happened to you guys?
It was interesting because he was finishing up middle school and then going into high school. So we didn't really do anything in the middle school timeframe because there wasn't a lot of school left. I'm a reader. I try to do as much reading as I can, and I get perspectives from other people, talk to some people online, get questions answered, and I learned that really 100% of type 1 diabetes kids should have a 504 plan. Research the ADA website. The school comes back with what they think, they're kind of their cookie cutter. Okay, they get this and that and the other. Because cell phones have become such a bigger issue with schools over the past year or two.
Yeah.
I was surprised at how much you need to advocate for your kids for a 504 plan and what they need to thrive in school.
Specific to cell phones or in general?
Generally, I think everything is okay. But I think with the cell phones, you have people say, well, kids dealt with diabetes, before cell phones existed. I think that the general public and even in education don't realize how important the cell phones are to keeping you alive and keeping you managed on a 24/7 basis.
Yeah, your regular NPH was not attached to a digital device that was controlling it.
Right.
It's almost more helpful just to talk about it as the insulin pump controller or the CGM receiver, and then spring on them at the end. It's also a cell phone.
Right.
It's so funny because I'm old enough. How old are you? Do you mind? Sorry.
That's okay. I just had a birthday. I'm 45.
Oh, happy birthday. I'm about 10 years older than you.
Okay.
When they started letting kids take cell phones to school, I was like, hey, this is a bad idea.
Right.
And then it was a bad idea, but it became commonplace, and people, especially parents, are so pushy. Then they my kids got to have this. What if there's a problem? How are they going to get a hold of me? The same way I got a hold of my mom in 1978 if there was a problem. When I got home, I spoke to her.
Right.
But okay, we got it into our heads that the danger that's around if you can't contact somebody immediately, and it became the norm, right? And by the way, there's a ton of good reasons that people should have communication. I'm not even saying that. Right. What I'm saying is it clearly messed with how school works, right? Like kids are can't put their phones down. It creates all kinds of other problems. It took us, when did I get my first iPhone? 2007? Is that right? Is that right? I think that's right. Okay. So if that's right, then nearly 20 years later, we all went, that was a bad idea letting kids take phones to school. It took 18 years for people to go, we probably shouldn't give them a screen to porn and games while they're trying to learn.
Right.
Or whatever else they're looking at. But mostly games and porn, just in case you're wondering what they're doing.
Oh, boy.
Yeah, just put your head down. You don't want to know. Point being is that in that time, some really good things came out of it. Like, hey, you can see your CGM on your phone or give your insulin for your phone. Or I'm sure there's a number of things outside of diabetes that has a lot of value for. And now we're going to tell everybody, nope, you can't have them. And then there's the part of me that goes, yeah, that's a great idea. And then there's the part of me that says, well, what are you supposed to do? Because then I say, well, Jennifer's kid gets to keep his phone, but not your kid. And where's that going to lead? A shit show and a half in 5 minutes. But anyway, you're trying to get the 504 plan in place. They're not understanding the necessity of the phone, especially in this time where the pushback is now going the other way. Is that what you're saying to me?
Right.
Yeah.
Yeah. And I think, they got the point that seeing the numbers and keeping the phone close and everything. But one of the things I fought for was his ability to communicate with me during the day if needed.
Well, I made that impassioned plea about you don't need to talk to your parents all day. But I'll tell you, if you can text with somebody who's helping you manage your diabetes, especially when you're younger, you don't know it's such a big deal and it makes everything so much better. So look at me arguing with myself. It's fun.
Well, and I think that if you have something in writing and you have, legal protection, then nobody's going to get in trouble and there's not going to be any problems. Yeah. So I think that, being proactive and advocating for your kids is just so important on so many levels.
Some kids are going to be like, just say, hey, look, I need this. I don't care. But when the rules start flying back the other direction where people can't have them, there are going to be some people who are going to be embarrassed. Now your cell phone is going to be a way for people to know that you have an illness or something.
Right.
Yeah. So then there are going to be kids who struggle with that, not wanting to take their phones out. I already talked to people whose kids are like, I can't get him to give himself insulin in class. Why not? He doesn't want to pull his phone out when no one else is allowed to. Mm-hmm. That nobody wants a spotlight shined on them. It's interesting how the problems will continue to morph and shift off of the issue. But did you finally get it set into place? Did they argue for a long time? Did you need an attorney?
No, we didn't need to make it go that far. Everything got into place just fine. I just kind of sometimes just had to make myself clear, I guess, go into mom mode.
So when you made the sound about 504, it's more about the speed bumps that you look back on and go, this didn't need to be this way, right?
Right.
Yeah. It's just frustrating and it's a lot of extra work that in the end everybody goes, oh, okay. And you're like, yeah, why were you fighting with me?
Right. Well, and it's interesting because I think, I talk to families with, multiple different chronic medical conditions, right? And a lot of people will say, okay, do you have a 504 plan? And people will say, what's that? So it's interesting to know, that it's not even common knowledge that someone may need one.
Right. Or they go, oh, is that an IEP? And you go, no, not really. No, it's not really the same thing.
Right.
Yeah. I guess I remember your frustration because at one point I recall telling somebody, you can argue about this as long as you want, but when it's over, this is what's going to happen.
Right.
And I know that's way more direct than most people probably. People have been telling me.
I get it.
Yeah. People online have been telling me I'm very direct and I keep fighting with them, which I guess is part of me being direct. I don't see myself as that. I know that's maybe insane, but I don't see myself as being direct. I just see the world as like more common sensey. Like, why would you not say that? That's right. And if I'm wrong, then I'll be shown to be wrong and then I'll stop saying it. But yeah.
And I hear a lot of, people want to complain about things, right? In general, people would rather complain about things than not be active and do something about it. Right.
Yeah. No, it's easier.
So I think it's easier to just be upfront and say, this is the way it's going to be, like you said.
This is what's going to happen. I said, you can fight if you want, but when this is over, this is what's going to happen. And then when it happened, the problem is then if one side keeps ego about it, now you're at odds forever.
Right.
Because now that person feels like I beat them because people are insane. But I guess the way the mind works is it's bizarre.
Right.
So, okay. So now it's set in place. You probably never even look at it.
Right.
Are you happy you have it still?
Absolutely.
Why?
Well, like I said, I think it's just legal protection. I think if somebody in the hallway or somebody who doesn't know him or a substitute or somebody wants to get him in trouble, then you say, nope, that's not going to happen.
Yeah. It is that easy sometimes. Like, put your phone away. I'm giving myself insulin. Put your phone away. I don't care. Well, you're going to care because the administrator's about to tell you to shut up. So,
right.
It really is that. It's more like a document that keeps people who don't understand your situation from being a jerk to you. That pretty much is
exactly.
Yeah. Well, and then if something goes wrong, you can get it fixed because it's been laid out somewhere and agreed upon.
Exactly.
Yeah. Which is why they try to pass off a super simple 504 to you because it's less for them to comply with.
Right.
More importantly, fewer things for them that they could potentially get in trouble for.
Right.
Always look at it like that and you'll know where people are coming from.
Right.
Anyway. Okay, so management stuff.
Mm-hmm.
You don't know what you're doing. You get people to talk to you plainly, but did that help? Or did you find yourself like, my people are great? Or were you like, uh-oh, I'm not getting much helpful advice here?
No, I mean, I think, a lot of people talk about horrible hospital experiences. I think that we had a pretty good experience. Everybody was really good. I kind of got online right away, I'm in some Dr. Mom Facebook groups and got connected to some people who, kind of gave me some basic advice. One of my favorite expressions that I learned early on from someone, I wish I knew who it was, but they said, don't drink from the fire hose.
Yeah,
and that has stuck with me because I think you get so much thrown at you at one time, and I can't imagine what it's like to not have a medical background and have all this stuff thrown at you.
So even with things being thrown at you quickly and you understanding a lot of contextually what it was still too much.
Yeah.
Okay.
Yeah, exactly.
I made that Defining Diabetes series because of that idea. Like I thought everyone's yelling buzzwords at people and they don't know what they mean. And they say like you don't realize if you're a person who says bolus all the time, that there are a lot of people who go, I don't know what you're saying. So, and then you just keep rolling on with it. And the person you're talking to is back there going, I guess I'll figure out what bolus means later. And then maybe this will all make sense. Nope, it won't. So what did you find? Like, I know how I think of it. I mean, it's not a secret. I think of it the way it's in the Bold Beginnings series. Like that's how I think about the beginning. But what did you find that was helpful?
Just talking to people, really, and I think that the people in the hospital did a great job with him and with me. And, it was less than 24 hours that we were in and out, and, put a Dexcom on him right away, which was great. And, it turned into a pretty good experience. Went back to school the following day.
Did you really? He's right back again?
Oh, yeah.
Well, did you have that, like, we can do this, nothing's going to stop us vibe going?
I tried.
You tried. Is your husband in medicine too?
He is.
Yeah. Is he like just a different kind of doctor?
He's an anesthesiologist.
That's the best job, isn't it?
Yeah. He just doesn't, he talks to them, puts them asleep.
And he pops on a podcast, right?
Yeah. I guess
like,
so.
I don't know what he does. I don't ask him. Hey, listen, an anesthesiologist saved me recently. I've been put out a number of times. Actually, my son said to me the other day, he goes, you've had a lot of surgeries. And I was like, yeah, I was thinking that the other day too. When I get the Jackson juice, it burns like crazy for me. It doesn't for everybody, by the way. So last time I had to have it, you're laughing at what part? The Jackson juice? Yeah. Okay. So yes. I said that to the anesthesiologist. I'm like, hey, easy. That's going to burn. I was like, is there anything you can do about that? And he goes, oh yeah, no problem. And he tourniqueted my arm and kind of like put it in a little slower and then held it for a minute before he let it through and it didn't burn. And I was like, I remember thinking, thank you, but I couldn't actually say it because I was gone.
Right.
But now if I have something done, it's the last thing I tell people. I'm like, are you aware of how to do this? Because otherwise, when they inject it into my IV, my arm feels like it's on fire. And then that goes across my chest. And that's like my last remembrance as I pass out.
Oh,
I mean, meanwhile, I guess it really doesn't matter because you're asleep in like a split second. Tell your husband if he ever wants to come on to a podcast to explain the complexities of the idea that we understand that anesthesia makes people go to sleep and wake back up again, but we don't understand how. I'm fascinated by that conversation. So, yeah.
Oh, yeah. He would love that.
I was just saying it to Arden the other day. She was talking about something medical. She's like, why can't they just, I was like, Arden, you know what? I said, do you know that we don't know why anesthesia works? And she goes, what? I'm like, the stuff they put in you. You fall asleep, you don't die, and you wake back up when they take it away. And she goes, yeah. I said, we know that happens. We have no idea why. She's like, what? Right. I'm like, yeah. Now imagine what else we don't know. Yeah.
Right.
But okay, so he's been through med school. You've been through med school. But does somebody take the reins on the diabetes thing? Or do you have that like, we're trying to stay very vague about your children. Is your child of the age where you're like, oh no, it's theirs to take over? Or did you feel like, no, I should be helping?
Yeah, it's pretty much all me. Like I said, I work part-time. So, and because I'm more on the general practice kind of side of things, I tend to manage most of it. as far as I'm the one who's calling the insurance and, making the appointments and sending the messages. I mean, the nice thing about having a teenager who is smart and functional is that he does a lot of it himself. Every once in a while I'm like, oh, is it a Dexcom day? Or so a lot of it is on him, but
by choice. Like, does he want you not to be involved, or is it
no,
he's looking for help?
No. I mean, I'd say it's a team effort, but he's very intuitive.
Okay.
Which I think is good. It's funny because we've even had his endocrinologists, the nurse practitioner, say, don't make changes on your pump without talking to us. And I'm going, okay.
Yeah, I'll call you up before I change the basal from 0.65 to 0.7.
Exactly. Now, there has been time. I mean, we definitely communicate with them. I try not to play doctor with my kids. So, I do want to communicate with them and make sure that everybody's on the same page. But I think for little things like that, that's definitely something he and I can do together.
You feel like you'll grow together? Do you have an expectation that at some point he's going to look at you and go, okay, that's enough now? I'm good. I don't want you involved anymore. Do you think he'll keep accepting your help?
I don't know. I guess we'll see with time.
You're not an anxious person, huh?
That depends who you ask.
I know your husband thinks you are, but I'm asking you. Yeah.
He probably does. Yeah. Yeah. I mean, I'm definitely a worrier, but I think it just depends on what's going on.
More so since you had kids?
Definitely.
Yeah, that's the thing. I know I've probably joked about it one too many times, but I was like, I think there's a switch in there and the kids grab it on the way out and they like flip it. And then because my wife was a lot more chill before like I made her pregnant. But it's good though, right? You're keeping the kid alive. Not good for you. It's good for them. Like you're very vigilant for them. That's awesome.
Right.
So I will tell you, as a person who's been at this for a very long time, being the parent of someone with diabetes, there is more than likely going to be a moment where your child is just like, hey, I'm good. And they're probably not really going to be. But it turns into more of like a psychological necessity at that point. You're going to have to at some point like create boundaries, and he'll probably make them, and then you're going to have to like find a way to like live with them, not ruin your relationship, but still at the same time make sure that the health part is okay. It's a really unfun part of this whole thing. In case any of you are wondering what comes next, it's not a big party. But you get through it, like, and it's a process like the rest of it.
Right.
What kind of outcomes are you having right now? How does what do you think of as a spike at a meal? What are numbers you're shooting for? What kind of A1Cs are you trying for? Or how do you like your variability, stuff like that?
I mean, the crazy thing that, about diabetes is like, doing the exact same thing every day and your numbers are going to be different because that's just the way it is. One thing that I think helped early on was that one of the doctors said, the goal is to not be 100% in range, right? All the time. And I think that, knowing that the goal is not perfection and that the goal is, being safe and having quality of life and, functioning and feeling good, I think is the point. I don't know if it's on the Dexcom app or the Mobi app, but they do give a percentage on the bottom of the app about like your time in range, which I think is good and bad if you're a numbers person.
Because if you think that any number under 100 seems like failure to some people.
I mean, I could see where some people might feel like that, right? And because every day is so different, you might have a day where you're 50 to 60% in range, right? And then you might have a day where you're 90% in range.
Yeah.
So I think that seeing that and can sometimes be a little bit frustrating, I'm sure. But yeah, I mean, the goal is to, make sure he's feeling good and keep numbers in range as much as possible. But I think that, aiming for that 100%, I think is tough.
You don't feel that way? Like it's failure if you don't do a certain thing? If not, how did you get to that?
No, I don't. And I think that, like all things in parenting, you see things online, right? And you see, at first I was following all these people online and, oh, my kid only eats veggies and meat and blah, blah, blah. And, And you're like, oh, well, I wish that it was like this and I wish it was like that. But in reality, I think you have to do what works best for you and your family and your situation.
Mm-hmm.
Right.
Yeah, for sure. I agree. Like, so how does that happen? You look online for what? For community, for people who understand, for answers, that kind of thing. At some point, you find someone who was like, I'll tell you what I did. I eat 1 carb a year and it's fixed everything. And you're like, okay, well, that's what we'll do. Right. Because they show you a beautiful graph and you're like, yes, I'm looking for that.
Oh, yeah.
And then what does it hit you 5 seconds later? You go, I would like a piece of bread once in a while. Like, hold on a second. Like
Exactly.
Yeah, I didn't want things to change that much. Does that leave you feeling like it's an all or nothing situation? Like, well, I either have to be completely no carb or I have horrible blood sugars?
Not necessarily, but I think that probably takes time to get that message through.
Yeah.
And I think there's a lot of that in parenting, the comparing to other people and, well, my kid's reading at 3 years old and, my kid's in advanced classes and my kid's not. And, there's a lot of that, I think, in all aspects of parenting. So I think that it's important to step back and realize, again, what works for your family is what works for you. And I counsel that a lot in my job with different aspects of life. So a lot of this has kind of turned over into the way that I counsel families and do reassurance and have empathy for their situations and talk to them about their life.
Yeah. I find that the messaging I hope I'm giving out is that there is a standard that you're reaching for. You don't need to get to it today. And
exactly.
You also don't want to get halfway to it and go, that's good enough. It's a process. And that process may take longer or shorter for different people. And you're certainly not going to get through it quickly or at all if you don't have at least some of the tools and the basic understandings. So go find those understandings, live through your experiences over and over again, and keep making adjustments till you find the thing that works. The tough part is that the diabetes is adjusting while you're adjusting.
Correct.
Yeah. It's not a lot of fun.
Right.
It really isn't.
Right.
Can I ask you a question?
Okay.
Yeah. So this is have I not been asking you questions? Do you just think have you not been asking me questions for the last 40 minutes? You dumb. But so I just talked about this with another person, so it's going to come up in the podcast in succession. So for you guys listening, I'm sorry. But so you're a mom, your kid has type 1 diabetes, not for a long time, but for, a rather newer diagnosis. You're also obviously who you are professionally. If I told you that I have on my website, I've just not made it public yet, I have a calculator that if you put your weight into, it would give you an average start for insulin to carb ratio, basal, and sensitivity. Would you say, I think that's a good thing for people to see?
Possibly.
How much does your child weigh?
Mine? I have no idea.
Can you ballpark guess?
Maybe 130.
Okay. So if I type 130 in as the weight, it will tell you that an estimated total daily dose is around 32 and a half units. Do you think he uses about 32 and a half units a day? Or is that wildly off for him?
No, that's probably possibly about right.
About right. Okay. Is his basal about 0.68 an hour? 0.7? Does he use
I'm not sure.
Does he use about 16 units a day in basal?
That sounds about right. I think it's
okay. Do you think a unit moves him how far? Like when you're doing a correction, if he's 200, what gets him to 100?
Maybe 3 or 4 units. I'm not sure.
It could be more. Yeah, it's interesting. This tells you it says, look, here's an estimated start for your insulin sensitivity. 1 unit drops you by 55 at a standard 8. So it's using, for insulin sensitivity, it's using the 1800 rule to find the number. Mm-hmm. You can switch it to use different, like a more resistant or a more sensitive rule. Same thing for the insulin to carb calculation. It's being done by the 500 rule, which is where the math comes from to figure out people's starting rates for their carbs. And for basal, there's different factors. It's using the standard, which is 0.55, but it also gives you opportunities to switch to high sensitivity resistant or highly resistant. My question is, if you had that, because you have access to people, you talk to a lot of people. So if it's true that people are being asked to do something with specious settings, they're not quite sure if their settings are right. Would it not be helpful to give them something that says, look, these are about maybe where you should start looking at your settings for? Does that seem like a value to you?
Possibly. I know we relied on his doctors to kind of create those settings and at the beginning and periodically when we check in, and those are all on his phone, which is why I said I wasn't sure.
Yeah, no, of course.
So all of those settings are there. And I know that the medical professionals created those settings and we adjust up and down, as needed.
Mm-hmm. I'm wondering, because you're a doctor, like if you could somehow look at this calculator and go, okay, well, these are the mathematical formulas that an endocrinologist is using to get a starting point for these numbers. Right. Would you consider sharing it with somebody or would that scare you? And if so, what scares you about it?
I would probably let the specialists do that just because a pediatric endocrinologist has 3 extra years of training compared to me.
Yeah.
So like my residency is in general pediatrics and I did some rotations in endocrinology. But if you're an endocrinologist, pediatric endocrinologist, you've done 3 more years on top of that. So I feel like probably leaving it to them to create the mathematical goals and do that, at least to start everything is a good thing. Like I said, we kind of adjust up and down in increments if needed, but I think getting their perspective from the beginning is important.
How long has your child had type 1 now?
A year and a half.
Year and a half. The reason I asked you a question about the calculator is because you're very new at type 1, but you've been a doctor for a very long time. Mm-hmm. So you're going to be more risk adverse about like just telling people like, hey, click on this link. But at the same time, have you not gotten a lot of your information that way?
Right. That's true.
Yeah. Yeah. So it's interesting. The reason I ask is because I'm going to spend a fair amount of time this year talking to people in clinical settings. Mm-hmm. I want to be able to say to them, listen, I've been doing this for 12 years. This is what they need to know. And these things will help them get to it faster. Mm-hmm. But you've got to believe that it's a big leap if you're a person who went to medical school or you're a nurse or, a professional person and a guy comes along and goes, hey, I make a podcast. Everything that I know about diabetes is in these series right here. I think if you listen to them and understand these t-shirt slogan sayings about type 1, you'll be well on your way. But you do need good settings. So here's the thing that'll help you get to that. Godspeed. Like take all that, synthesize it together, apply it to your own life. And I think you're going to be better off if you do. How do you make a person because that's my pitch, Jen. And by the way, I believe it. Okay. And I believe it because I've seen it work for, honestly, countless people. Mm-hmm. So but how do I say it? But what I just realized is when I said it to you, you were kind of like, I don't know. I don't think so. I want, and you've listened to this podcast, right?
Yeah.
Yeah. So you listened to this podcast. You've had some success, I would bet, on things that I've said. And what's your kid's A1C?
Right now, probably around 6 point something.
Yeah, you're doing good. And when I said, hey, do you think I should tell people about this? You were like, What made you go,
Well, just kind of like, I don't know. It's hard to explain. It's good to get online and get people's perspective of things, I think. Like when we were looking at pumps or, various to get information, right?
Yeah. Yeah, go ahead.
But.
May I?
Yeah.
You trust yourself.
Yeah.
So if we step out of this conversation and you as a doctor look at you as a parent situation, you say, well, yeah, that person was able to go online, get things and synthesize it and put it together because they were a doctor and they had more critical thinking. But what about the people who don't have the critical thinking? So you think it's possible that you had success because you had knowledge that other people don't have. I'm telling you that this works 8 to 80, blind, crippled, or crazy. It doesn't matter.
It's just like a lot of things. Half my day is people coming into my office saying, well, I looked at this online, or I found this on Google, or I asked ChatGPT.
Right. And so you're freaked out because what if they're getting bad information, but you got good information when you did it?
Right.
That's going to be my problem when I'm talking to doctors. So you've just identified for me what I have to change about my pitch. Thank you. Because here, I'll pitch it to you a different way. You may or may not know this, but if you go to one of these AI like models at this point and ask it diabetes questions, it's going to give you some pretty rock solid advice.
Oh, yeah.
Yeah. I just had a medical problem cleared up for me because of ChatGPT.
Oh, definitely.
Something I struggled with forever. I talked about on the podcast recently. If you haven't heard it, it's worth listening to. I was hilarious when I explained it. But I'd still be struggling today if it wasn't for that. And you could say, well, you could have Googled it. I did Google it. It didn't work out that way for me. Like I couldn't get an answer that way. I've seen people drop their graphs into a model and ask it where they think they're making their mistakes with their insulin. And without any context, it's being valuable to them.
Right.
So, but I get also that I don't want just people running around yelling out into the ether and whatever they hear echoed back at them, they just start doing. But I'm not saying that. I'm saying that when a person is lost in the woods, if you don't have a flashlight and a map to give them, it still might be nice to stand off in the distance and yell, over here, and see if they can't make their way to you. Right. That's kind of how I think about it. I know that the medical system, and for a lot of good reasons, does not think about it that way. But you know, I'm going to guess a couple 100,000 people have listened to this podcast, and they're doing okay. So so I'm trying to figure out how do I leave that message, because I have until April. I have until the middle of April, because I have, hey, Scott, I am the diabetes coordinator for the office, and I am thrilled to announce that you have been chosen as the keynote speaker at our symposium. So I have about, I got about 3 months to figure out how to say that. So anyway, I like that you were, I could bounce it off of you for a second. Thank you.
Sure.
Yeah. But your reaction told me a lot. It was very helpful, because you're a lovely, reasonable, smart person. I've been talking to you for an hour, and you listened to the podcast and got value out of it. And still, when I said, should we tell other people about it? You're like, oh, I don't know, man. That was pretty good information for me. I appreciate that. Anything in your story that we haven't touched on, stuff that you want to talk about that we've missed? I don't want to miss any of your topics.
I guess just talking about like the way that it's changed the way that I practice medicine a little bit.
Yeah.
And it's not just diabetes, but just really kind of any chronic medical condition too. One of the things that I try to address, I try to be a whole picture kind of person. Mm-hmm. So if I know I'm seeing a sibling of someone who's, I know the sibling has been undergoing cancer treatments, or the sibling has had some health problems, I try to make sure that the siblings are okay and the families are okay, and how can I help kind of thing.
Yeah.
Or what do you need kind of thing. I'd like to admit that I was like this before.
You don't think you are?
I don't know. I think that it has changed a little bit. Like I said, I definitely know more about the school stuff and the 504 and the, just in general. I recently was on the phone with a school for like almost an hour talking about a kid with not diabetes, something else. But I think it's just wanting to help those kids and those families navigate the healthcare system, because it can be really challenging if you don't know what you're talking about.
What I feel like I'm hearing is that as your family's story gets deeper and richer, and you have more perspective and experiences, that's impacting how you're talking to people in the practice.
It is.
That's what people mean when they, when they say like, oh, my doctor's great, they've been doing this forever. It's that stuff. It's the nuanced stuff, the stuff that nobody teaches you or writes in a book, that you get out of that. Like it's life. Like you have more life now than you had before. And now you have a really great place to apply it. And answer for me, why is it that stuff wasn't common sense before you had the life experience? And this isn't me coming down on you. This is me trying to understand the human mind. Like, because honestly, now that you've said it out loud, it's not like it's some great like stroke of genius, right? To say to somebody, hey, your brother's sick, I'm going to be a little more compassionate to you. Like, so what do you think that is? Is the job just so clinical that it doesn't allow for that, or what is that?
It is. And a lot of it is time. I'll be honest.
Mm-hmm.
If you're doing a well child check and you have 15 to 20 minutes in with someone, you're going over a lot of things in that 15, 20 minutes. But I think I've also learned to kind of pick and choose what needs to be gone over.
Okay. So your experiences are making you reallocate the time differently.
Correct.
Gotcha. It's like when they ask you, what's that one pediatrician thing that they clearly, you're supposed to assess their mental health, right? If they're depressed, and you do it with like a one sentence. What's the sentence? Say it.
Well, there's different screenings that we're supposed to be doing with the kids. Like there's one called a PHQ-9. I tend to just talk to the kids about how they're doing or if there was any concerns.
I have an interesting experience because my kid's pediatrician, who's no longer their doctor, they're older now, but was a friend. And so he'd like look and go, Arden, are you sad or anything?
I don't say that.
Yeah. And she'd be like, no. And he'd look at me and I go, she seems okay. They're like, all right. And that was sort of how it would go.
Right.
But so you have like these little like lead in questions that you're supposed to ask, things you're looking for, that kind of stuff.
Right. Yeah. Right. And I think like, I tend to not argue with parents as much if they're wanting something that's relatively easy. You know, a lot of people come in and they say, well, I want labs or I want a referral or I want this. And a lot of the times if it seems reasonable, I'm like, okay.
And prior you'd be like, this situation doesn't call for that, or I don't feel, and instead you're like, this will make them happy or comfortable or satiated.
Exactly. So, if you feel more comfortable checking some lab work and we have a reason and like something we can code for and you're concerned, I'm fine doing it.
Yeah. You have a tough enough life. Why am I making a fight here?
Exactly. Yeah. Exactly.
And that comes from now, you know what it's like to have a tougher life.
Right.
Prior to Arden's diagnosis, I would tell you that I had a 2-year-old and a 4-year-old, and I had just bought a little house and we were fixing it up and we had property and everything, like we were doing okay and everything felt like it was going on. And I was like, oh, my life this is what I was trying for. Like, you know what I mean? Like all this stuff is happening. Mm-hmm. And prior to that, like any of the hardships I had before that were gone. Like I'd kind of like moved into another part of my life, you know? And then this happened and I was like, oh God, like I didn't expect this level of resistance from the world, you know? And it was really a shift. And I'm wondering, like, did you have a similar experience where things were going okay and then suddenly this happened? Or did you have a lot of struggles that prepared you for this?
No, I think probably a very similar experience. You know, when you're just cruising along and then, you know, my grandfather used to have an expression where he would say, man plans and God laughs. So, you know, but I wouldn't say it changed too much. I mean, we still travel. You know, I think when you originally maybe get the news of the diagnosis, like, okay, what's going to change? Right. Well, we still travel. We still do the things that we want to do, you know, but you have to adjust. So, but I think that is the original fear, of course.
Yeah. So it's not perfect, but you make your way through it. Okay.
Yeah. We try.
I feel badly when, like, you're talking about how, like, you know, how things can impact people. Like, I mean, it was hard. I'm not going to say. And like, I've said this before, I didn't have a podcast to listen to. You know, a lot of the things that I just say off the top of my head now that people are like, oh, Scott's so lucky. Like I had to figure all that out by like, you know, living through horrible situations. Still, I'm okay. You know, like but it wasn't great. Like there were years of like, oh my God, this is going wrong, you know, and this isn't going to be okay. And she's going to have real problems. But I don't know why I didn't give up, to be perfectly honest with you. I'm just happy that it's sort of not how I'm like built or whatever. But now I look up and I see people who have access to help or information or even ideas, you know, and then they can't get to them. And then that kind of breaks my heart too.
Oh, right.
Because you know what people are going through and
absolutely
some of it's just not necessary.
Yeah. And and I mean, I see a lot of kids who don't have supportive families and it's, you know, don't have transportation to their specialists and don't have people who are taking care of them. And I think that is even more difficult.
Yeah.
And sad.
Out of 10 random people, how many kids do you think are living a life with a parent that's not supportive in one of those ways?
You mean on a regular day?
Yeah. Like how many times a day do you walk out and just run your head into the concrete wall across from the door when you walk out?
Boy. Multiple. No, probably a handful.
Yeah.
Yeah.
It's tough.
Yeah.
I mean, have you sat quietly and thought about that? Like, what's the help there? Or is there just nothing to do?
Definitely.
Have you come up with any answers? Like, how do you circumvent a parent that's not valuable in the situation?
I mean, it's definitely tricky. You can't call CPS on everybody. I try to just make sure that they have what they need and, any referrals, or like I said, I try to say, how can I help? Sometimes it's just a tricky situation.
Yeah. Does it end up, I mean, you've been at it long enough now. Think back 10 years ago to a family that you were like, uh-oh, this is a show and this kid's in trouble. Did it end up that way, or do things have a way of working out when you don't expect them to?
It's hard to know from 10 years ago because a lot of times people fall off the grid. So, if there was somebody at that point, they may not even be in our town anymore or in our practice, or, hard to know. Right.
Yeah. You don't always get to like see somebody all the way through. Is that tough?
Exactly.
Is it hard to like put so much effort into somebody and then not see the result, or is that part of the job?
I mean, it's kind of part of the job, I think, especially when you're in a practice there's 6 of us in our practice. So, I'm not always seeing the kids for everything. So sometimes people will bounce back and forth between different doctors. So you may see them for a little bit and then not see them for a little bit.
Yeah. People don't even consistently come when they're supposed to?
No.
Oh, you said that like no dummy. I can't believe you asked that like a question. I would never not do that. That's why it doesn't occur to me.
Yeah. Well, I'll see someone who said, "Oh, I haven't been here in 3 or 4 years." So, well, A, you're lucky.
Yeah.
Right. That you haven't needed a doctor in 3 or 4 years. And B, I say, well, you're here now and that's all that matters.
You just made the same noise my son made to me the other day when I said, like, I go, this is going to sound, I don't know if it's going to sound Pollyanna or childish. I'm not sure. But I said, man, so many people drink too much in the world. It's not part of my lifestyle. So I don't really I'm not aware of it, I guess.
Mm-hmm.
But he laughed and he went, yeah. He's like, dude, everybody. And I was like, gotcha. It's also, by the way, you do whatever you want. I honestly don't care. Me and my kids had this conversation again recently about like judgment.
Mm-hmm.
And I stood there and I was like, listen, I am not judgmental. I was like, you can live your life any way you want to. That's not going to stop me from assessing it the way I see it. But my assessment's not a judgment. And I was like,
Good
and that's
point.
only a thing you can measure in my heart. So you have to believe me.
Mm-hmm.
Like if you ask me to talk about a life's ill, like in like stark terms, I guess you'd be like, wow, that's really judgmental. But the part you wouldn't hear is that like, if that's their life and that's what they want, whatever. Like, I don't really have an opinion about what other people do. I have an opinion about the idea, but not about your decision. And I keep like, I'm like, God, are they going to understand what I'm saying at some point or not? Because I think people who listen to this would say, generally speaking, like, I don't think Scott's judgmental at all. Like, I think I'm pretty live and let live. Like that's my vibe. But if you ask me, like, do I think you should be drinking a case of beer every couple of days? I have some pretty strong thoughts about that.
Right.
Yeah.
Me too.
Yeah, you're right. But if that's what you're doing, like, go get it. You know what I mean? Like, it's sorry with me. Like, just, pretty much it. Anyway. And so when I said that about the drinking, my son was like, yeah, duh. Like, which is anyway, what you just made me think of when I was like, do people not come to their appointments? You're like, yeah, idiot, they don't. Okay.
Sorry.
I didn't know that. I just, like, if you tell me I made this baby and I got to take care of it, I'm taking care of it. Like, I don't know. Like, again, I'm not even taking credit for it. I think I'm just wired that way, or my past experiences have put me in that situation or whatever. Anyway, so, okay. Well, this is interesting. Like, do you think you'll keep practicing?
I do. I'm still young in the field of medicine, I guess. I always think that maybe I'll do some other things, but this is kind of what I know how to do.
Mm-hmm.
So I don't really want to start over and do something else.
Well, if you keep that promise to yourself and I can keep this podcast going, would you like come back in a few years?
Absolutely.
I really want to hear how you've morphed.
Okay.
Yeah, because you're very new at this. And you don't even realize it. You're like, no, I've been at this a year and the year and 3 months, Scott. I don't know if you heard the 3 months. Okay. You're going to like 3 years from now, you're going to have such a different perspective. And I am super interested to figure out how it impacts your profession.
Mm-hmm.
Yeah. Keep me in mind is what I'm saying.
Okay.
I mean, did you have a good time?
Yeah, definitely.
Good. You're a little reserved. So sometimes I didn't know if I was insulting you or you're just being proper. Do you know that about yourself? Are you being professional or are you reserved?
I don't know. I talk on the phone to a lot of people, parents and stuff. So maybe it's just me being.
You were measured a couple of times. You're like, oh, I'm not going to say that out loud. He joked about this. I will not respond to that. But I made you laugh a couple of times, which made me
You
feel.
did.
Yeah.
Yes.
I'm like, oh, I got to her. Which, by the way, is why I told the masseuse, let's not start, okay? Because if you start chatting me up, I am going to feel like a compulsion to make you laugh, and I'm trying to relax. Okay.
Yeah.
You were lovely, Jennifer. Thank you.
Well, thank you.
Seriously. Do you think you'll keep listening to the podcast for support, community, or do you think you were there for information and you have it?
I think I will. I tend to be a little bit choosy, can I say? A lot of things that I see online and things that I look at are younger kids.
Mm-hmm.
And, while it's still helpful for me, maybe in practice, not really personally.
Might not feel the same.
Yeah. So it feels a little bit different. But so I kind of go through the podcast and look for things about teenagers and various things. And so it hits home a little bit more for me.
Gotcha. Yeah. Well, don't miss knowing all of your tools, part 1 and part 2, because in part 2, I talk about the medical thing that happened to me. And if nothing else, I believe I was hilarious when I explained it. So you don't want to miss that. I also think that, not that I'm telling, I crank out a lot of content. I'm not telling you have to listen to 20 episodes a month, although please do. But what I am saying is that I think there's something in those stories sometimes that you don't know the value of until the day you need it. And then suddenly you have it. Maybe not unlike, what you're learning about, your own personal experiences and how they're helping you at work. So
right.
I just like to tell people that one of the reasons, when people are like, why don't the descriptions of the podcast tell you exactly what the episode's about? There's a couple of reasons. One, if you even just stop and think about the last hour, what the hell was this about? You know what I mean? Like, how you breaking that down? You can't break that down into a sentence. But two, let's say it was about I don't know, celiac. And, say that when we got done, you were like, well, what we basically talked about here was celiac and this. I know it's not what we talked about, but let's say that was it. And I put that in the description. Today, Jen comes on. She's a pediatrician who's blah, 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 blah. And you see 2 words, you go, I don't need that part.
Mm-hmm.
And then you miss the rest of it.
That's true.
That's the thing about it. Maybe I'm giving myself credit and I don't mean to be, but I think that these conversations are really valuable in ways you can't even know all the time, even while you're listening to them. And sometimes it takes time before you go, oh, I'm glad I heard that.
Right.
So,
right.
Anyway, keep listening if you like. If you don't, there's other people listening. I'll be okay, Jen.
I will.
Yeah. All right. Hold on 1 second for me. Okay. You really were terrific. Thank you. Happy New Year.
Thank you.
This episode of the Juicebox Podcast is sponsored by the Omnipod 5. And at my link, omnipod.com/juicebox, you can get yourself a free, what'd I just say? A free Omnipod 5 starter kit. Free? Get out of here. Go click on that link, omnipod.com/juicebox. Check it out. Terms and conditions apply. Eligibility may vary. Full terms and conditions can be found at omnipod.com/juicebox. Links in the show notes, links at juiceboxpodcast.com. Dexcom sponsored this episode of the Juicebox Podcast. Learn more about the Dexcom G7 at my link, dexcom.com/juicebox. Thank you so much for listening. I'll be back very soon with another episode of the Juicebox Podcast. If you're not already subscribed or following the podcast in your favorite audio app like Spotify or Apple Podcasts, please do that now. Seriously, just to hit follow or subscribe will really help the show. If you go a little further in Apple Podcasts and set it up so that it downloads all new episodes, I'll be your best friend. And if you leave a 5-star review, I'll probably send you a Christmas card. Would you like a Christmas card? If this is your first time listening to the Juicebox Podcast and you'd like to hear more, download Apple Podcasts or Spotify, really any audio app at all. Look for the Juicebox Podcast and follow or subscribe. We put out new content every day that you'll enjoy. Want to learn more about your diabetes management? Go to juiceboxpodcast.com up in the menu and look for Bold Beginnings, the Diabetes Pro Tip series, and much more. This podcast is full of collections and series of information that will help you to live better with insulin. If you're new to type 1 diabetes, begin with the Bold Beginnings series from the podcast. Don't take my word for it. Listen to what reviewers have said. Bold Beginnings is the best first step. I learned more in those episodes than anywhere else. This is when everything finally clicked. People say it takes the stress out of the early days and replaces it with clarity. They tell me this should come with the diagnosis packet that I got at the hospital. And after they listen, they recommend it to everyone who's struggling. It's straightforward, practical, and easy to listen to. Bold Beginnings gives you the basics in a way that actually makes sense. The Juicebox Podcast is edited by Wrong Way Recording. WrongWayRecording.com. If you'd like your podcast to sound as good as mine, check out Rob at WrongWayRecording.com.